going on. Southbound Tri-State at LaGrange Road, the right lane is blocked with debris. I-80 westbound, there's a jam from 80th Avenue to LaGrange Road. There was an earlier car fire, and the right lane is still blocked for cleanup there. I-55 northbound traffic is tight, River Road to Arsenal, and southbound it's slow, Arsenal to River Road as well. That's traffic. I'm Jim Talamonte on AM 560 The Answer.
Chicago's Morning Answer continues next. Your official Chicagoland weather forecast. From the 1 Hour Heating and Air Conditioning Weather Center, clouds and sun, 51 today. Partly cloudy and 36 overnight. It is 38 at O'Hare. Next news coming up at 7. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
This hourly segment is brought to you by Get Down to Business with Shalom Klein, the show for business and jobs powered by Tandem HR. Heard Sunday evenings at 6.
Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560, The Answer.
Good morning, Dan and Amy. Dr. Tony Fauci, during last night's briefing, addressed questions about the state of the antivirals that are in clinical trials or under consideration for use to treat COVID-19 infection. Here's what he had to say on the topic.
There are a number of candidates. The drugs that are now being looked at in various ways, either compassionate use, clinical trials, are generally drugs that already exist for other things. There's a whole menu of drugs and interventions that are now going into clinical trials that are not approved for anything yet. I mean, for example, things like immune serum, convalescent plasma, or hyperimmune globulin, or monoclonal antibodies, a variety of other things. Right now, there's a lot of activity going on behind the scenes in the design of the kinds of clinical trials that will give us an answer. Because you need an answer, because if it doesn't work, you want to get it off the table and go to the next one. So there are a lot of things. Vaccine.
How long does that normally take? Weeks, months?
Yeah, no, it takes at least months. So, I mean, that's the reason why you're seeing a lot of activity with drugs that already exist for other purposes, because they're already there. But the drugs that you want to show in a good randomized clinical trial, at very best, are going to take months.
Yeah, and I think that's maybe a little confusing to people, the way that was said. He's distinguishing between drugs that already exist. Those should not take months, right? Because you're talking about an off-label use for a drug that already exists, like hydroxychloroquine or remdesivir. They already exist. Now you're talking about using them for something they have been used before, which is, of course, to treat COVID-19. He's talking about new procedures, new drugs to come on the market that haven't been used for anything. That's what he's talking about. Takes months. Just an important distinction, because the way he said it, I thought may have been a bit confusing to people. I still didn't really get a handle, though, from him or Trump on when hydroxychloroquine, and there's 1,100 trials, as it were, of that drug going on in New York at present, when we might get an answer as to whether that could be used widely, where the FDA will clear it to be used widely. Because, as HHS Secretary Azar mentioned on Sunday, they've stockpiled millions of hydroxychloroquine tablets and Z-Packs.
And we had Dr. Adams on, the Surgeon General of the United States, yesterday, and he said, yeah, it does work for some, but for others, it does not work. And that, they're still, searching for other things as well.
Well, right, but
this is the most promising one out there so far.
And again, this goes back to something Trump said. This goes back to something that medical professionals have written about in the journal that we mentioned. The standard here should be safe and effective, or just safe. And when speed is an issue, and these are trade-offs, speed and safety sometimes, should the standard for particularly an off-label green light from the FDA, should it be safe and effective, or just safe? My argument would be safe. For more on this, we're pleased to be joined by James Copland. He's a senior fellow with the Director of Legal Policy his senior fellow and the director of legal policy, I should say, for the Manhattan Institute. And he's written about the real-life costs of bad regulation and bad regulators. James, thanks for joining us. Appreciate it.
Thanks for having me.
How did you receive what Dr. Fauci had to say yesterday, and as particularly as it pertains to these antivirals coming online or not coming online?
Yeah, well, I think you characterized it very well. I think it was confusing to a lay audience because normally a drug has to go through exhaustive clinical trials with the FDA and be determined safe and effective. But once that hurdle's been cleared for a drug for a use, it can be prescribed, as you call it, off-label for any other use, whether that's been shown effective to the FDA or not. And basically what you're doing is saying, well, the doctor has the safety profile through the clinical trials. The doctors know what the side effects are, and therefore can weigh the evidence. So that's one way a lot of drugs, and that's what hydroxychloroquine and chloroquine phosphate and these other sorts of anti-malarials are, right? I mean, these are drugs that have long existed for decades as malarial treatments. They have other treatments as well. The side effect profile is very well known, and so they've been used. They are being used en masse in various situations. In New York, they're using them a lot. I had a friend on a ventilator there. This was part of the treatment protocol that was used there. Now, the evidence is mixed on this. There's some evidence coming out of China saying, well, maybe this doesn't work at all. There's other evidence out of France, which at least anecdotally suggests some promise, and some people have written on it, but we really don't know for sure. But it is part of the protocol that's being used right now in the absence of anything better.
Well, tell us about some side effects from hydroxychloroquine combined with the Z-Pak. Because you had mentioned your friend, and you wrote about it in your article, but what are some of the side effects that he and others are experiencing?
The side effect profile is relatively modest for this, but can be serious. I mean, certainly people don't want to try to do this on their own, and they can't really. I mean, there's, I guess, the one example of someone who tried to drink fish cleaner. That's really a bad idea. I mean, this should be something
form
handled.
of chloroquine.
Wow. Yeah, I mean, this is something that should be done only by a doctor, only for severe cases. I mean, this is again someone that was a fairly severe case that's being used, and doctors are doing this depending on the severity of the case, and the Z-Pak thing is really an antibacterial thing, but sometimes you want to combine those. You don't want people suffering from this to get a bacterial infection either. So sometimes they'll be mixed. And that's sort of one of the standard protocols you're seeing. But there are other drugs being used, as you suggest, under the compassionate use program, et cetera, compassionate care, emergency use. And hydroxychloroquine on the 29th actually was green-lighted with an emergency use authorization. So this is actually something that the FDA has largely green-lighted. I think the rationale for that, given that it is already being used, is because some states had put barriers up to its use until the FDA said it was okay. So I think that's why the FDA did that.
Yeah, that's right. But you mentioned others have been used in compassionate care cases, like remdesivir, which is also in trial.
Exactly.
And showed promise in 2 cases of severely ill men in Washington State. And so you can understand why people, myself included, are a bit anxious to get more details from Dr. Fauci and the president about the time horizon to complete those trials and make a decision. Because if you get those antivirals online and distributed, then that could be a real game changer. You want to talk about flattening the curve in terms of lethality rate. That could happen virtually overnight if there's the promise that there seems to be in one or more of these treatments.
Yeah, and I don't expect that anytime soon where you would get these online. I mean, again, these are either experimental or drugs that have real side effects. I mean, listen, the side effect profiles aren't that bad. I mean, it's not as if you weren't using anti-malarial drugs like hydroxychloroquine, regularly if you go to Africa as a prophylactic. But that doesn't necessarily mean that that's the same dosage profile you'd use in a severe case like what we're talking about here with someone who's really got an active COVID-19 situation.
And I know this isn't a trial and you don't want to over-extrapolate from the anecdotal, but when you're talking about people that are in, sort of last rites territory, you have case studies from Washington State with respect to remdesivir, and you have other case studies with respect to hydroxychloroquine. Again, right to try. Why not make it more public that we're going to clear right to try or per doctor's discretion for drugs that have shown promise where we have real world case studies?
Yeah, I've long argued that, and in fact, and this is a point I made in the column you referenced. And I agree with your general instinct here, safe and effective versus just safe. There is value in doing efficacy trials through the FDA, but there's also value in getting drugs out there more quickly. And we see that right now. But in the ordinary case, we don't often see it. And if you drag on for years, even longer than a decade, getting drugs to market that actually would save lives in these less critical situations, you're still talking about real lives being cost by the FDA based on efficacy trials. Whereas maybe, at least for certain types of drugs that have real life and death potential consequence, safety trials are what you want, and then you allow this sort of off-label standard for all classes of drugs that might be life-saving, and let doctors really weigh the evidence out there. I mean, they're not going to do it perfectly, but then you can create various regulatory incentives to get the efficacy trials in there too. But we know that off-label prescribing for certain types of situations is extremely common. I mean, 21% of all approved drugs are used off-label in some form, according to some published studies. 39% of ICU emergency care type applications of drugs are in fact off-label today. So this is commonly done, and maybe we ought to remove more of those barriers so some of these drugs that are more experimental could be out there once we know the safety profile.
And what do you think about the CDC's in-house testing design?
Well, this is the real bungle here, and this is something I think a story that hasn't been told as much as it should. Everyone's focused on the political actors, but these agencies that are not run by political actors. I mean, Dr. Hahn at the FDA is a noted oncologist, ran one of the biggest hospital systems in the U.S., and Dr. Redfield at the CDC, Fauci's boss, is a virologist who's done decades of HIV research. But these folks really messed up the testing process, and they did it by designing their own CDC test in-house, which ended up not working in the first instance, and not allowing the private sector to sort of innovate here, as has been done in other countries and as we're seeing now. And what we're seeing now is Abbott Labs coming out with new tests that are quite quick. Henry Schein coming out with antibody tests that are quite quick. Yesterday there was an announcement of another test that may even be quicker than Abbott Labs' test. We're seeing this sort of innovation, but the FDA only granted its sole emergency use authorization for testing, which was granted, I think, February 4th, shortly after the emergency declaration by HHS Secretary Azar, only granted it to the CDC. So the CDC manages this all in-house, and there's only 4,000 tests completed in the United States by the end of February. Completely unacceptable. The main reason why we have this response that we have now is that we were completely unable to do something like what South Korea did and try to contain and trace this. That may not have worked anyway, but it would have certainly been much better if we had widespread testing available more quickly. And what this tells us is that these experts, while they're really important for us in times like this, they don't know everything. And so they understand medicine. It doesn't mean they understand mass production and distribution as well as these companies that do that for their business. And so they may pick a test that's the perfect test. In this case, it wasn't, but they a perfect test. But there are certain reagents necessary for the test that you can't get out on the market, or there's certain problems in distributing this test, et cetera. And so allowing the private sector to innovate here would have been much, much better. It's starting to be now, and it shows this sort of institutional bias of the perfection over speed, making the perfect the enemy of the good that we see time and time again with these regulatory agencies.
Well, this is a real case study in government versus the dynamism of the market, central planning versus the free exchange. So in 3 weeks in February, CDC processed 4,000 tests. In 3 weeks since the March 12th authorization for Roche, they've done 1.1 million tests. Wow. What a difference. What a commentary on central planning. James Copland, Senior Fellow with and Director of Legal Policy for the Manhattan Institute. James, thanks for joining us. Appreciate it.
Thank you.
Take care.
And he joined us on our turnkey.pro answer line.
Connect with Dan and Amy on the AM 560 The Answer mobile app. Just text the word app to 64636 to download the app today.
The Lou Dobbs Financial Report is brought to you by Signature Bank, helping local businesses succeed. Visit signaturebank.bank for your commercial banking needs.
I'm Lou Dobbs. The nationwide rush is on to build field hospitals in major cities. Amazon workers face a huge crush of deliveries, and a judge blocks a Dallas sick leave ordinance. Those stories next.
The coronavirus is wreaking havoc here in the United States and across the globe. The stock market is plummeting. Sports leagues are suspending their seasons. Schools are sending students home, and the entire U.S. economy has been destabilized. Many experts say this is just the beginning. This is a devastating risk if you're heavy in stocks with no safeguard.